The following message is a paid advertisement. Instrumentation Industries has been supporting clinicians for decades with specialized medical products made just south of Pittsburgh, Pennsylvania. They design and manufacture trusted solutions for respiratory anesthesia, critical care, and emergency care, from manual jet ventilators and transtracheal catheters to connectors, gauges, and cuff pressure monitors. They're also a go to OEM partner for leading cardiopulmonary companies. You can learn more at iiimedical.com. Welcome to today's episode of the AARC Perspectives podcast. I'm Lisa Weisenberger, AARC Director of Content and Communications, and I'm joined today by Gary Wong, Chief Clinical Officer, Islands Respiratory Health and Hawaii House of Delegates Representative. Thanks for joining me today, Gary. Could you tell me a little bit about your journey to becoming a respiratory therapist and why you chose this profession?
Lisa, my journey actually began about 45 years ago when I was volunteering as a ward clerk in the ICU. One day, we had a critical admission coming from the ER, and my job was to immediately contact respiratory therapy to begin mechanical ventilation. Watching that RT stepped in and massively managed the ventilator and literally gave the patient life-saving breath really sparked my fascination with critical care and the vital role RT plays. Since there wasn't a respiratory therapy program available in Hawaii at that time, I traveled to Southern California for my training. It was an incredible environment, and by my second year, I was already working at a tertiary NICU. But my heart was always home, so I decided to return to the islands to practice at the Women's and Children's Medical Center. And eventually, I transitioned into the home health care practice because I wanted to gain business and management experience. And at that time, the DRGs were taking effect in the hospital environment, so home care was in its absolute infancy, where COPD patients were just starting to be discharged and managed with home supplemental oxygen via concentrators and liquid oxygen. That early taste of management set the stage for the rest of my career. I actually went back to get my MBA much later, and after I had fully ventured into healthcare administration, I worked for some health plans, physician practice management, and did some clinical operations.
Wow, you really have had a journey through a lot of different pieces. So, how does the multicultural fabric of the Hawaiian Islands shape respiratory care for you and what you do?
It absolutely shapes everything we do. Hawaii is very uniquely multicultural. Beyond our host culture, the Native Hawaiian community, we're a rich tapestry of immigrant communities from China, Japan, the Philippines, Korea, Vietnam, Thailand, Taiwan, Okinawa. And alongside, we have our Pacific Island neighbors from Guam, Saipan, Micronesia, and American Samoa. Because of this incredible diversity, you cannot practice medicine here with a one-size-fits-all mindset. Their language barriers are a daily reality, so we frequently utilize translation services to ensure patients and their family truly understand their respiratory care plans. But the multicultural competency here goes much deeper than just language. It's about understanding the core values of the islands. In Hawaii, we found a profound cultural dedication to taking care of our elderly, our kapuna. But from a health equity standpoint, we have to recognize that our Native Hawaiian and Pacific Islander populations carry a disproportionate burden of the severe respiratory disease. So, Lisa, when a kapuna is admitted to a hospital, it's not just the patient you're caring for, it's the entire ohana or family. It's incredibly common for the whole family, grandkids, aunties, uncles, to essentially camp out in the hospital waiting room to show their collective love and support. And as RTs, we don't just treat a pair of lungs, we embrace the entire support system to build trust, which is what truly drives successful outcomes here.
I'm sure that has to help your patients get better quicker, I would think, with knowing that there's all that love and support around them.
Right.
How did you decide to get involved in the Hawaii State Society of Respiratory Care and eventually become president?
That's a good question. I've always believed that you can't just stand on the sidelines if you want to see your profession grow. So I started getting involved with HSRC early in my career, but it was later when I transitioned to post-acute care practice that I saw an opportunity to make a real impact. I had noticed that the presidency of the HSRC had become a closed loop, often rotating exclusively between the professors at our respiratory care practitioner program. So the reality was it was rotating because no one else was volunteering and there was no active effort to recruit new board members. So I felt it was time to break the cycle and build a true culture of inclusion. At that point in my career, I wanted to give back to the society that had given me so much. So I looked at where the energy already was. Most of our current board members were actually active student leaders who had volunteered their time while still in school. So by actively inviting them and harnessing that natural enthusiasm, we were able to make a massive difference.
So you mentioned a little bit about how the Hawaii State Society had really helped you. How did AARC help you grow your career?
So ARC, really, when I look at it, they have been my professional anchor. When you operate in an island state, it's easy to feel like you're on an island professionally too, but the ARC completely bridges that gap. So on a personal level, when I stepped into the House of Delegates to represent Hawaii on a national level, it has been incredibly rewarding for me. It really gives the islands a powerful voice in national discussions, but it opens up an entire world of professional growth. So, the networking alone is invaluable, but you learn best practices from colleagues across the country, bringing that knowledge home. So the ARC really, when you look at it, Lisa, it gives you a platform to join specific committees and specialty sections where you can collaborate directly with your peers who share your exact passions. For me personally, it's meant diving into committees like the COPD Best Practices Group, working with HOSA to inspire future healthcare professionals, and staying active in the political action, management, and ambulatory post-acute care sections. So collaborating with these groups, really puts you on the cutting edge of clinical care and administration and plugging you into a national brain trust. So when you look at it, the ARC took me from being a local therapist to being a nationwide collaborator and advocate.
You sparked my interest when you were talking about HOSA. What kind of things do you do with HOSA there in Hawaii?
So HOSA, is a national initiative of the ARC to, get the students interested in becoming an RT. So I took the challenge last year, and because I already was participating with a healthcare academy at one of the schools here, I collaborate with the teachers there, and then they in turn work with the HOSA state director, and we put it on a fast track. I did some training webinars and mentoring. And then we were proud to have our first HOSA event last March. And we had seven students participating from Kauai, Maui, Oahu, and the Big Island. So it was kind of surprising. And so next year we'll do it even better. And I'm sure based on the workshop that the respiratory school put on, we had standing room only of over 100 people where we give a demonstration on intubation and mechanical ventilation, simulating an ICU setup. So I'm sure the students will be interested to signing up. And then we gave them some stickers to put on their water bottles. And that seems to be what the kids want nowadays. So it's kind of exciting working with the youth. But we're going to go down to the middle school level to try to get them interested because that's where they sign up for the healthcare academies.
That's great. Yeah, the big HOSA conference is next week, and AARC is going to be there having a booth and doing all kinds of different things. So it's always to hear about when other states are doing similar things on a more localized level. So that's great.
Yeah, it's just making a connection with the kids is really the main thing in inspiring them to look at our profession, because usually they just look at nursing, or med school. But once they figure out what we do, some of them really gravitate really quickly, like I did, 45 years ago.
So, what are the challenges you've faced as a third generation Chinese American in the medical profession and in respiratory care?
Yeah, it's kind of interesting because we really didn't think about, that aspect. But, now with APPI and last month in May was Heritage Month, I've been reflecting on this quite a bit. So growing up as a third generation Chinese American, you really inherit a powerful legacy from your parents for hard work, humility, and quiet dedication. But when you practice in Western medicine, the cultural inclination to put your head down and just let your work speak for itself can sometimes be misinterpreted as a lack of ambition or leadership capability. So as I mature in my practice and looking across the country, we can see more strong APPI representation at the clinical bedside. But I notice when I attend the national events, there's still a significant gap when you look at executive boardrooms and national policy tables. One of my biggest challenges was to learn to break out of that quiet mold and find my public voice, stepping up to lead and aggressively advocating for systematic changes. But what I really want to share with the mainland audience is that our cultural values aren't a weakness in leadership. They are a strength. So I had to learn to be assertive. Yes, I brought a leadership style rooted in listening, consensus building, and a deep respect for community. So I learned we can bridge that gap by balancing the humility we're raised with fierce assertiveness required to fight for our patients and make sure our diverse communities are never left invisible at the national level.
So, what do you see as the opportunities in respiratory therapy, especially in Hawaii?
Lisa, the opportunities right now are immense, particularly in driving innovation within the post-acute, subacute, and remote care. Mainland colleagues often think of Hawaii as a pristine paradise, but we really face a massive respiratory challenges from the unique environmental triggers like the volcano erupting, causing fog, the high humidity we have here, and the year-round allergy cycles. And because we're an island state, really, geography dictates our healthcare realities. About 80% of our 1.2 population lives on Oahu, and it's supported by 7 hospitals here. But on our neighbor islands, however, it's entirely a rural healthcare community with very limited access to specialists like pulmonologists. So when a patient becomes acutely ill there, hospitals frequently transfer them to Oahu via fixed-wing air ambulance, making the cost of care astronomically expensive. So looking at it, we can bridge that gap by expanding advanced home healthcare models, which includes managing complex mechanical ventilators right in the home. When we look at it, we have a massive opportunity to pioneer virtual care models and advanced COPD monitoring technologies to protect these vulnerable populations. So when we kind of lean forward and utilize advanced diagnostic monitoring and telehealth, the RTs here in Hawaii can really manage complex pulmonary patients right in their home communities. So it's an incredible space where clinicians are leading healthcare advancements and changing how care is delivered.
I guess you don't really think about the rural aspect, but it totally makes sense with the having to transport if there's a situation that happens too. So, lots of opportunities, it sounds like. How do you think the Respiratory Care Interstate Compact will affect RTs in Hawaii and really across the country? Since I know you get a lot of travelers in Hawaii, RT travelers. How do you think that'll make an impact?
Lisa, when you look at it for our profession, and ARC is leading the way. The interstate compact is really a game changer for our profession, but it's really complex for island state like Hawaii, where we're going to introduce legislation this year. Our legislative session begins in January, so we're actively seeking lobbyists. But nationally, we know it's going to completely revolutionize workforce mobility. And in Hawaii, it really allows RTs from the mainland to cross state lines and seamlessly help us during disaster response and public health crisis and acute staffing shortage. But in Hawaii, our workforce constraints are incredibly unique. We only have one accredited respiratory therapy program in this entire state, and it produces a cohort about 16 to 18 graduates a year. And at the same time, like everybody else, we're experiencing severe work shortages accelerated by the anticipated retirement of our baby boomer generation, like me. And so when we look at it, our society looks at it to fill these critical gaps, especially on our neighbor islands. They have to rely heavily on traveling RTs, like you mentioned, Lisa. So we see the compact will streamline that process significantly, making it easier to bring in the hands-on help we desperately need without bureaucratic delays. And then the other thing people don't realize is it offers an incredible advantage because of our heavy military presence on the islands. We have a massive active duty and dependent population, and we have military bases, Army, Navy, Marines, Air Force, and Coast Guard here on the islands. So when you look at it, the compact is really a beautiful tool to support all those Department of Defense dependents who practice respiratory therapy. It allows the military spouses to maintain their careers and continue working without the long, frustrating headache by getting state by state relicensing every time they receive, permanent change of station orders. He's coming to the islands. The only thing that makes it a transition period because they really come into a unique community fabric, and we have our local terminologies and island nuisances. But if we can balance that cultural connection with the workforce mobility of the compact, it'll be a massive step for Hawaii forward to stabilizing healthcare across Hawaii.
So, as we wrap up our conversation, is there anything else you'd like to share about respiratory care or your journey or just how people can get involved?
Yeah. Well, first of all, thank you, Lisa, for having me and the audience for listening to the podcast. If there's one message I want to leave with the respiratory community across the country is this: don't wait for the invitation to lead, whether it's stepping up to join your local state society or mentoring a student who's eager to learn or flying to Washington, D.C. to fight for life-changing legislation like the SOAR and AIR Act. Our profession only grows when we choose to actively shape it. And so to the next generation of practitioners, especially to my fellow APPI clinicians, your unique perspective, your cultural humility, and your dedication to community are not quiet background. They're your greatest leadership strengths. Bring them to the table. We have a massive opportunity to pioneer how longitudinal care is delivered and protect our most vulnerable populations, where they're in the heart of a major city or in a rural island community. So here in Hawaii, we have a beautiful concept called imua. It means to press forward, to look ahead, to move with strength toward a common goal. So to all my colleagues on the mainland and across the miles, imua, let's keep moving our profession forward and together. Mahalo, nui loa, and aloha.
That's great. Thank you so much, Gary, for joining me today for this episode of the AARC Perspectives podcast. For more information about getting involved in your local state society or the Respiratory Care Interstate Compact, please visit aarc.org. And don't forget to subscribe to this podcast wherever you listen, and be sure to share this valuable resource with your colleagues and other AARC members.